Hi, my name is Scott Kipling. I'm going to do a head-to-toe assessment. Prior to doing this head-to-toe assessment, I would get a complete history, past and present, current medications if the patient is taking any. Also, I would look at the mobility of the patient, if the patient is able to walk on her or his own, and using a cane, etc. To see the mobility of the patient. Also, before to do the head-to-toe assessment, I've already checked the height and weight and did the vital signs. Hi, my name is Scott Kipling. I'm going to do your head-to-toe assessment. What is your name?
I'm Dagan.
Dagan. Do you know what today's date is?
June 22nd.
Very good. And do you know what time it is?
No.
Okay. 4 o'clock.
4 o'clock.
Okay. And do you know why you're here?
To get a head and toe assessment.
Okay. The first thing I'm going to do is I'm going to do an inspection of his head and his face, just to make sure everything is symmetrical. Okay, good. And then I'm going to just look in here, and I'm also looking for if he has alopecia, and I'm feeling if there's any painful spots. After the inspection, I'm going to palpate just to see if there's any painful nodules or masses. Is anything painful?
Mm-mm.
Okay. The next thing I'm going to do is I'm going to observe his eyes. I'm going to look and see if they're symmetrical or not. Good. And I'm going to see if there's any dryness, redness. Okay. And then I'm going to check his look straight ahead. See if his eye constricts. All right, next I'm going to check. You just follow my finger. I'm checking cranial nerves 3, 4, and 6. Good. 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 Okay. Also, when I'm checking his face, I want to see if he can raise his eyebrows up. Good. Down. Can you show me your teeth? Good. Can you pucker? Good. And that's checking his cranial nerves, his trigeminal and facial nerves. I'm also going to... You feel that? Good. Feel that? Feel that? Good. Next, I'm going to inspect the mouth. I'm going to see that if it's pink and there's no ulcerations on the outside of the lips, I'm going to ask you to open up. Good. I'm going to look inside. I'm going to see that everything inside, there's no ulcerations, lesions. I'm also going to ask them to go ah.
Ah.
And I'm going to look at his uvula to make sure it's midline. Also stick out your tongue. His tongue should be midline if it's checking the hypoglossal nerve. Okay. Also, when I look in his mouth, I'm going to look at his teeth, making sure they're white. They're all there, no chips. Next, I'm going to check his carotid artery, the palpation and auscultation. Okay. We'll auscultate it using the bell. And I'm listening for bruits. If there's no bruits, then his carotid artery is okay. I'm off. Now I'm going to check the cervical lymph nodes, and I'm also looking now at his skin texture to see if it's oily or dry, and I'm also feeling for any kind of pain that he has back here or any masses. Right now I'm going to check all his lymph nodes, and the reason why you're doing that is first to see if there's pain, tenderness. If it's swollen, there could be some kind of inflammation process happening. Right here is the preauricular lymph nodes. Is there any pain?
No.
Postauricular lymph nodes. Any pain?
No.
Okay. Check the superficial lymph nodes. Any pain?
No.
And then I want you to check the posterior cervical. Any pain?
A little on the left side.
Okay. Next, I'm going to go to the upper extremity. The first thing is I'm going to check this radial pulse. I'm going to listen to the rate, the rhythm, and character of the pulse. I'm going to go to his brachioradialis pulse. It's the same thing I'm looking at, feeling, and hearing. Also, I'm going to look at his skin to see that the feel of his skin to make sure it's the right temperature. Also, I'm going to look and see, I'm going to do some tugger on his skin to see if he is hydrated and if he has any edema. Also, I'm going to look at the capillary refill. It should come back within 2 seconds. Okay. The next thing is I'm going to do, I'm going to check some deep tendon reflexes. I'm going to go in here, check in. Good. Good. And I would do this bilateral. That's checking for an upper motor neuron lesion. I would also check his sensory. Do you feel this?
Mm-hmm.
Then I would also check muscle testing. I'm going to check his biceps. Hold this hard. Don't need to pull it down. Good. Hold it. Don't need to push up. Good. Bring your wrist up. Pull it, push it down. Go up. Good. And bring it up. Good. Just relax. Yeah. Bring your wrist down. Don't need to pull it up. Yeah. Keep it right there. There you go. Good. All right. And that's checking the motor function. This is a pediatric patient, and I do have consent from their parents to do a thorax, chest, and abdomen inspection. Okay, we're going to lower this down. Okay, good. And right now I'm inspecting his chest to see if it's all symmetrical. And I'm looking to see if there's any masses, barrel chesting. And I'm going to go back here and I'm going to look and see if he has a kyphosis.